Winter is here, and so is a formidable foe, the super flu. This isn't your average seasonal sniffle, it's a mutated strain of influenza A, known as H3N2 subclade K, sweeping across the UK. But knowledge is power. In this video, we'll uncover what causes it, how it's impacting our communities, and most importantly, how you can protect yourself and your loved ones. Let's dive in. What causes the super flu? The super flu arises from the natural evolution of the H3N2 virus. Over the summer, it underwent antigenic drift, small genetic mutations in its surface proteins, resulting in 7 new changes that make it more transmissible, with a reproduction number of about 1.4. This means it spreads easily, especially where immunity is low. Contributing factors include reduced exposure to similar strains in recent years, particularly among children, leading to gaps in protection. Environmental elements like damp or mild weather, sudden cold snaps that drive us indoors, ongoing school sessions, and even delays in vaccine rollouts in some areas all fuel its spread. Human behaviors, such as close contact in public without precautions, accelerate transmission. Right now, it's hitting younger people hard before potentially peaking in older groups. The impact on the UK is severe, a tidal wave of illness that could be a once-in-a-decade event. Hospitals are under immense strain, with an average of 1,617 flu patients daily last week, a record for this time of year, 56% higher than last year and 10 times higher than in 2023. Critical care beds are filling up, with 69 patients reported, and hospitals in places like the West Midlands declaring critical incidents due to overcrowding and long A&E waits. Communities are feeling it too. Schools in areas like Cheshire have closed. NHS 111 calls are up by over 11,000 compared to last year, and ambulance handovers are increasing. The season started over a month early, adding pressure amid ongoing NHS challenges. Without action, we could see higher deaths. Last winter alone saw around 8,000 flu-related fatalities, and the peak is still ahead. Symptoms. Recognize the signs early. Symptoms hit fast and can be intense. Extreme tiredness that knocks you out, high fever, a persistent cough, runny or stuffy nose, body aches, and sometimes vomiting or diarrhea, especially in kids. If you're under 5, over 65, pregnant, or have conditions like asthma, diabetes, or heart disease, watch closely. These groups are at higher risk. If symptoms worsen, seek help right away. How we can prevent it, but here's the good news: prevention works. Step 1. Get vaccinated. It's your best defense. The current vaccine is still 70–75% effective at preventing hospital visits for kids aged 2 to 17 and 30–40% for adults against this strain. It's free on the NHS for eligible groups like the elderly, pregnant people, those with chronic conditions, kids via nasal spray, and carers. Healthy adults can grab it at pharmacies. It takes 2 weeks to kick in, so don't delay. Over 16.9 million jabs have already been given this year. Step 2. Wear a face mask in public, especially if symptomatic or protecting others. Think back to those effective habits from recent years. Step 3. Practice top-notch hygiene. Wash hands often, cover coughs with your elbow, and ventilate rooms. Step 4. Stay home if you're unwell, especially with a fever, and avoid vulnerable folks. For schools and workplaces, closures are a last resort, but prioritizing these steps can keep everyone safer. Remedies that could affect it in gurnal use. If you do catch it, there's no cure since it's viral, but remedies can ease the way. Focus on rest, plenty of fluids, and over-the-counter aids like paracetamol or ibuprofen for fever and aches. Avoid antibiotics unless a bacterial complication arises. For herbal help, echinacea might boost immunity, though evidence is mixed. It's no replacement for vaccines. High-risk folks, contact NHS 111 for advice or your GP if symptoms linger. Antivirals like oseltamivir may be prescribed for severe cases, and if exposed, getting vaccinated post-exposure can still milden symptoms. Only head to A&E for emergencies. Get vaccinated today. Share this video. The superflu is tough, but together we can beat it. Get your jab, stay vigilant, and spread the word, not the virus.